It's not that far away. Sierra Leone is closer to London than it is to South Africa, so it's not that far away. And the best way to deal with the epidemic is to deal with it in Africa, and it's not over yet. But then MSF doesn't just work with Ebola. You know, right now we're starting a new migrant scheme in the Mediterranean. There's a cholera outbreak in Malawi and Niger. Yemen's being bombed. We're the only people who got in, along with the Red Cross. So we're working everywhere, wherever there's strife. I've been away 4 times before with MSF, but at the same time it's recognised this is harder than anything, the Ebola epidemic, and so we had in-team psychologists, so we had sessions with them regularly, specifically for us as opposed to ones for the patients. And also, you know, all of us were not first missioners, so you know, we work together, we live together, we talk to each other, recognise that we're having difficulties. When one of my patients that I was really close to died, I recognised that I was completely upset about it, and I let myself cry. You know, I went to his grave, I mourned him. You've got to go through it, otherwise if you pent it up, it's going to hit you badly at a later date. See, all the survivors, we're working out that there are sort of syndromes now of survival, you know, multiple aches and pains, joint problems, psychological traumas as well. They've lost whole swathes of families. So for the individuals that have survived, there's a big recovery coming on. But for the communities, you know, there's a problem there with healthcare that's not been given for the last year, schools that have been closed for the last year, the entire economy has been devastated. I mean, only last month, Britain, you know, the government, our government here, has pledged like 300 million towards a fund to help their economies of this region recover. So there's a lot to happen in the coming year or two.